listeners. Thank you so much, the facilitator of this session. This is Dr. Angela Musimenta from Mbarara University of Science and Technology. And in the studio, I have Dr. Ambrose. And as usual, our dear listeners, we are here as a continuation of the Open Learning Program that we have been bringing to you with financial support from the Swedish program for ICT in developing and emerging regions, or what we abbreviate as SPIDER. We've been doing this targeting learners that are hard to reach, but especially during this COVID-induced school lockdown. And as you know, we've done quite a lot in terms of teaching openly, focusing on mathematics, focusing on basic health sciences. And today we have come with an interesting package, and this is a package about COVID-19. I'm here. I am not a medical doctor, definitely, but I have a medical doctor in the studio, and I would like, Dr. Ambrose, I would like us to talk about COVID-19 in the context of a refugee setting. Before I came into the studio, I checked on the WHO dashboard, and the statistics, the figures are alarming. They are purely unacceptable. Statistics are alarming, Doctor, because I found out that globally over 2 million people have already died of COVID-19, and over 95 million people have been confirmed cases of COVID-19. And we've had, within the last 24 hours, according to WHO dashboard, we have lost over 14,000 people due to COVID-19. That's in a day's time. So that is the global statistics. And in the Ugandan country-specific setting, since the beginning of COVID-19, or what we locally know or commonly know as coronavirus, we have had confirmed cases that are over 38,000. And within the last 24 hours, we have had 94 deaths in Uganda alone. And generally, the total number of deaths in Uganda have been 305 deaths. So that is alarming. That is unacceptable. That is worrying. And you know, if we look at COVID-19 and the prevention measures that are advocated in the context of Nakivale refugee setting, I have been there because we have been implementing interventions there since 2017 with the help and with the support of the same funder, SPIDER. You know that the context is very overcrowded. So when we talk about, for example, social distance, what does it mean? How can they really emphasize it? You know, the socio-economic status is really very low, to the extent that it's very possible that some of the households, some of the parents might not necessarily afford, you know, the cost of preventive measures, like, you know, buying sanitizers and all that stuff and masks. So what do you think can be done in this particular setting? How can we prevent COVID? How can we make sure that, you know, the prevention measures that are being advocated are adopted within this vulnerable population? Doctor, over to you.
Thank you so much, Dr. Angela. As you know, and you excuse me, our viewers, I will put off my mask so that I can be audible enough. And to our dear listeners, thank you for joining us on this radio program. We are glad to be in the studios of Grace FM to present to you about COVID-19. Thank you for the wonderful introduction about numbers. There's one thing that is common to all doctors. They are good at statistics and they know numbers. I'm not surprised that you are this updated. because for you to qualify to be a doctor, you should be someone who reads and who is updated. Back to COVID-19 or coronavirus, a lot of names have been given to it. And in Uganda, there's a point where we reached and we thought COVID-19 wasn't serious. We thought maybe we have another type of coronavirus that is different from the one that we have had from outside countries, the one that used to kill people. You know, for about the first 4 to 5 months, we didn't register any death, and it looked like there were no serious illnesses in Uganda. And it seemed that this could be another virus. Some people thought it is a political talk. It is one way of getting money out of government, and people were saying, to hell with the lockdown. We are tired of lockdown. We are tired of social distance. Let the bars open, let everything open. We need to go back to school. Until a time when coronavirus actually came and we realized that it is serious. I would like to appeal to each and every Ugandan that is outside there listening to us and to our dear viewers that COVID-19 is real. First of all, before I talk about the preventive measures of COVID-19, I would like to bring to the whole world and to Ugandans and to the people of Nachivale camp what COVID-19 really means. What is this virus? What is this that we've had? Something that has made us stay in our homes, something that has made students and pupils stay in their homes for almost a year now. We closed in March and we are coming to Feb. So a full year lost to our dear learners. So what is this virus? What has it made? Why do we have to worry? This is something that I want to explain in a very short time. First of all, coronavirus is not a new virus for people to understand. It has been there. There has been a class of viruses called coronavirus. But this specific species called COVID-19, SARS-CoV-19, it has come as a new strain of coronavirus, in that we've not had a similar case of coronavirus. We've had similar cases of respiratory viruses attacking the globe and giving us headache, but this is a new species of coronavirus that came, and it was first isolated in China. Hence the name China virus, China flu, such things. But it has been regarded as a global pandemic. That means it has entered into each and every country on this planet. And now, since it has become part of us, we need to know, how do you recognize that someone has coronavirus? Or how do you suspect that this person could be a patient of coronavirus? Now, there are typical symptoms that we usually see. One of them include cough, and the characteristic cough is that it is dry. It's usually a dry cough. And in a few cases you'll have a productive cough, but usually it is a dry cough. Then we shall have fevers, or what we call high temperatures. Someone will be running a fever, and usually this fever is not responding to our common painkillers, including Panadol. Yes, then we have sore throat and difficulty in breathing. We can have any other symptoms. Now the core symptoms are the symptoms that I've mentioned above. The cough, fever, sore throat, and difficulty in breathing. But you can have symptoms like vomiting, like nausea, like chest pain, like diarrhea. Since this virus is able to attack each and every part of the body, not only the lungs. Of course, the lungs is the focus of infection, but the virus is capable to attack each and every organ in your body, including your liver, including your kidneys, including your intestines, including your brain. So it is able to attack each and every part. But specifically, the first symptoms that we see are the above symptoms I mentioned.
If I can ask doctor about
please.
the symptoms, assuming I'm in Nakivale, somewhere there, and actually you've talked about the symptoms and it looks like I have some of them. What should I do?
Now, this is you've just preempted my conversation. So once you find out that you have the above symptoms, then we regard you as a suspect. We don't regard you as someone who is confirmed to have the virus. And now, this is the first thing that you should do when you have the symptoms, is to stay home. Before you rush to anywhere, you stay home and make sure you are not in contact with other people. Reason being, if you try to move around, then you increase the chances that if you have the virus, then you're going to spread it to as many people. Because the more you move, the more you get into contact with people. That's the idea of social distance. Now, to explain a little bit about social distance, this virus, being a respiratory virus mainly, you cough it, and when you cough, you release what we call cough droplets. And now those droplets contain the virus. Every person that is in touch with those droplets is able to get the virus. Now, the idea of a 2-meter distance is that the droplets of the virus in the cough are heavy and are unable to travel past the 2 meters distance. So if you are able to keep 2 meters distance, for example, you are able to make sure that each and every person who coughs, you are not in contact with their cough droplets. And therefore you have avoided the virus. So the first thing you should do once you have the symptoms stay at home. Now, the second thing that you should do is
maybe before talking about the second thing, sorry to cut you short. You talked of the 2 meters.
Yes.
In the eyes and mind of a common man, it might not be easy to envision, the distance that is referred as 2 meters. From a non-technical point of view, do you have like something you can give us to use as a basis to know that, okay, this is 2 meters?
All right. So back then when we were in primary school, there used to be a 1-arm distance take. Remember when we are in parades in school, they should say you should be 1-arm distance. Now, a 1 arm of an adult person is averagely close to 1 meter. So if you are able to be 2 arms distance away from an individual, that is close to 2 meters.
Perfect.
Yes.
Thank you so much. Yeah.
All right. So now the next thing that you do once you have the symptoms is to seek medical care. Now people ask, how do I stay home and how do I seek medical care? Now, one thing is that we have surveillance teams. As Mbarara Regional Referral, we have a team called surveillance team that is able to track down each and every person that is said to have symptoms. Second, if we have toll-free numbers that if you happen to have symptoms, you call, and these numbers have been displayed everywhere, even at districts, even at your local LC1 chairperson. These people have those numbers. So you are able to reach out to the main hospital through those numbers, and the surveillance team will come and pick you up. And that will help you from intermingling with other people in the process of getting a taxi. You are making people in a taxi get infected. So staying home and alerting the medical team is one thing that you should do once you have symptoms.
So meaning that if I don't have the number for the task force, I can go to my LC person for that contact. That's very helpful, because I know there are so many people that have been asking about those contacts, so we can always get them from...
And to add on that, each and every village has what we call village health teams, or VHTs. Now, each and every VHT is in touch with the surveillance team and is able to get to us once you have the symptoms, and we will reach to you in the shortest time possible.
Very good. Now, I had something about staying home. Now, I live with about 10 people at home. Now, if I identify some of those symptoms, how am I supposed to stay at home without putting them at risk of getting the virus, just in case I have it?
All right. So I I know it is hard in the context of the camp because you find one family with 8 people living in a very small house, and the ventilation itself is not good, and you may find you don't even have enough rooms. But if it is much, you try as much as possible that you isolate yourself. That's the idea of self-isolation. Now, we know as our culture, especially in this side of the country, we have a culture of loving people, of being next to people, and of gathering together. And most of the times when we have people sick, we want to care for them, we want to be next to them, and this is not right. We know however much you care about your people, whenever you see someone with symptoms, let them isolate themselves. Find one part of the house. If you are able to have rooms in the house, then you isolate one room and say, he or she is going to be in this room. And that room, you can only identify one person who is going to provide food. Keep taking food to that person. But that person is isolated from the rest of the house.
I actually know of an instance of a COVID-19 suspect who tried to do isolation in-house. And, you know, the households were, the household members were even fearing to bring food to the person. So it was so tough on them. To the extent that they thought of simply opening the windows and throwing in the food, and even after doing that, it was very hard for them to get the plates from the person. So do you have any specific advice?
So now for such a case, it's not to say that if someone is COVID-19 positive, has been confirmed, for example, doesn't mean that is a death sentence. As we would see in the statistics, it's the death rate for COVID-19 is low. It's actually not even close to 1%. So not every person who gets COVID-19 is going to die. However much that it is true that we need to isolate these people and we need to keep a distance from them. We need to put up measures to make sure that they stay close to us. For example, if I am going to take food for a person who is in isolation, I'm advised to put on a mask. Now, for such a case where you have a confirmed case of COVID-19, the masks that are made out of cloth or out of cotton, they are not helpful for that particular case. We need to have the masks that are called surgical masks, like the one I came putting on, and others are called KN95 or N95. Those ones used in the hospitals, because those ones are able to protect you. Now, and you use your hand sanitizer. Every surface you touch, you sanitize. You put on your mask, you put on your goggles if you have them, and then you take food for this person. You minimize the time in between these people. And after everything that you do in that room, you come out, you sanitize, and you take off the mask, put on another mask. It is one thing that will protect you, but also we need to feed these people. If you don't feed them, they will die of hunger before COVID-19 takes them. I know.
That's very helpful, Doctor. You talked of, these masks that are recommended in cases of a confirmed case. What advice do you have for people that might not be able to afford the mask? Typical of the populations in the refugee setting. What should we do? Because after all, those are the masks that the government provided.
Yes. So the masks that were provided by the government to the community, they are helpful in this sense that if every person puts on the mask, then we will have no transmission, because they protect the environment from you. The masks that are made out of cloth, they do not protect you from the environment. They protect the environment from you. In that when you cough, the virus is not going to go to the environment. And if everyone is putting on a mask, then we shall not have the virus in the environment, and therefore we shall not have transmission of the virus. That's the reason to say, wear it for me. wear the mask for me, because if you are putting on that mask, you are protecting me, and if I put on that mask, I'm protecting you, and that's it. That's the reason why we all have to put on our masks. But for the case of surgical masks, those ones protect you and protect the environment. But if you cannot afford, don't say, doctor said this one is not going to protect me. No, you need to protect the environment. Everyone is responsible, and everyone has a duty to protect the environment. And if we all protect the environment, then we are all protected.
I understand these are disposables, like the one you came with.
Yes.
Okay, so what does that mean? If I put it on today, can't I put it on tomorrow?
That's not right, because every time you put it off and you put it on a surface, you are contaminating a surface. And every time you pick it up and you are putting it on, it has been exposed to the environment. And that means there is a likelihood that this mask has been infected. And then you bring the mask back onto your body. So it's really not good to recycle the masks. If it is a disposable mask, once you put it on, you put it off. And now for those that are made out of cloth, then you need to make sure that every evening you put off your mask, you wash it, you iron it. Then that was the idea of giving at least 2 masks, so that if you wash this one, for example, and it doesn't get dry, then you have another mask that you should put on. But if you are able to iron your mask, even if it is not dry, iron it, make it dry, put it on the following morning.
Very great. If I can take you back to isolation, house isolation, in the context of, say, Nakivale refugee settlement, where you might find that there are no those rooms where the cases can be isolated to. What sort of advice do you have for the government, for the humanitarian organizations that might be interested in the welfare of people within such settlements?
Oh, yes. As the government and the Ministry of Health, there are specific isolation centers that have been gazetted. For example, in Mbarara, we have one at the Mbarara Regional Referral Hospital, whereby every confirmed case and is unable to self-isolate, we isolate them at the Mbarara Regional Referral Isolation Unit, and they are able to have all the care that should be given until when we find them fit to go back into the community. So in case you are unable to self-isolate, because before we give you a go-ahead to self-isolate, we have to assess one, that you are regarded as mild COVID, because for people with moderate and severe COVID-19 pneumonia, we admit them and then we have to give them care. Of course, most of them will require oxygen, which we can only provide in the hospital. But those with mild symptoms, mild COVID, we can give them oral drugs to take at home, and then we isolate them from home, those who are able to.
Very good. I have heard of instances where people have symptoms, and those symptoms, by all means, are COVID-19 symptoms, but for so many reasons, they don't want to say it out, they don't want to come forward for that kind of isolation. Some of them, they look at isolation, for example, especially outside homes. They look at it as a prison. And of course, there's a lot of stigma associated with that. What sort of advice would you give to such person? They have symptoms, but they don't want to come out.
Now, we faced that challenge, especially at the start of this campaign. Many people thought that once you are isolated, you are actually going to be infected more and you are going to probably die. And people had questions on what are we going to feed on, how are we going to communicate with family, so many questions. But the truth of the matter is, once we isolate you at our isolation center, we provide the necessary things that you should use. We don't completely cut off your communication, We allow you to communicate with family, and secondly, we provide the necessities that you require. So isolation is not another form of prison. Someone should not be scared and think I'm going to be imprisoned. No. Someone should see isolation as an opportunity to be taken off from the beloved ones that he or she should protect, and then given an opportunity to recover from the virus.
And doctor, there has been also issues of people fearing to associate with those that are cured of COVID-19.
The ex-patients.
Yeah, the ex-patients. What sort of advice do you have? How should we treat them? Because, of course, from the non-medical point of view, again, you can let us know whether it is true. But people have been worried about the reoccurring of the infection, and that it makes life very complicated within the communities because they keep scared, and in the process there is stigmatization, in the process there is discrimination, there is social isolation and all that stuff.
Yes. So there's one thing I want the community to understand about COVID-19. COVID-19 is not a death sentence. And not everyone who gets COVID-19 maybe got it out of bad luck or bad omen or was bewitched, as people might think. So every person who has been sent back to the community has been assessed by the medical teams and has been found fit to go back to the community. We do not send back to the community people that we think are still have chances of infecting others. To be specific, we test these people again and we confirm them that they are negative. So every person that has been sent off the hospital, now most of the, when we are sending them off, we give them certificate. If you want to prove, you can go to each and every person that we have sent back home. We give them certificate that verifies that they have been cured and they are fit to go back to the community. Now when these people come to the community, welcome them, let them be part of the community as they have been. And I'm sure these very people are the people who help us advocate and emphasize the SOPs, standard operating procedures. So they are fit to be in the community.
Very good. That's a very nice clarification. But have you had cases of reinfections?
Of course, we have had a few cases of reinfection. They are not that common. Of course, there has been studies to find out whether people who get COVID-19 really get immunity, or if they become immune and they are not able to get the virus again. But we've had the cases. There were so many documented cases in the Western world, and they have been cured. When you go home, you still emphasize on the standard operating procedures. You put on your mask, keep social distance, stay home as much as possible, wash your hands, and you make sure that you don't get reinfection again.
Very good. Thank you so much, Dr. Ambrose. So our dear listeners, we have been talking about COVID-19 in the context of what it is and how can we prevent it, how can we live again with people that have been cured of COVID-19, and how can a common person from Nakivale refugee settlement be able to adopt the advocated SOPs. Do you have anything else you would like to add on?
Yeah, just to add on something about hand washing. In our conversation, we didn't talk much about hand washing, which is one of the very effective way of preventing this virus. Now, many people have questions. I don't have a sanitizer. I'm unable to buy a sanitizer. I don't have these liquid soap. I'm unable to buy them. What can I do? In such a case, there was a campaign some time back about prevention of typhoid. There's a time we're here and we've advocated building or constructing TP taps. Now, these very same tippet apps are able to help us in this same campaign of preventing COVID-19. You can still use the tippet apps, use our normal soap. The bar soap, the soap that you use to wash your clothes, wash your utensils, is still effective in preventing this virus. Make sure every time you touch surfaces, you wash your hands if you're unable to use a sanitizer. It's still a very effective way of preventing coronavirus. Just to mention a little bit more thing, I still want to appeal to every Ugandan that COVID-19 is real. Despite the fact that we've been in elections, we expect that the transmission rate is likely to be high because of the rallies of the election time. We've been a lot of SOPs were not handled very well. So still make sure that you follow the SOPs, be very vigilant. Everyone that has symptoms, alert the medical teams so that we can fight together this pandemic and have our life normal.
Very good. Thank you so much, Dr. Ambrose. This is very insightful. I am glad we have learned a lot from you. And within the remaining few minutes, let's see if there is someone with a question, anyone with a question regarding COVID-19.
Now, the first person asked, is a mask harmful to your health? Does it affect you? When you breathe, does it affect you? Now, these masks have been made in a way that they don't allow you to rebreathe the air that you breathe out. They have filters that make sure that the air that you breathe in is filtered, and the virus, if you carry a virus, will not go into the community or into the environment. And even when you are breathing in, you don't breathe in the virus. Now, these masks may seem uncomfortable at the start, but once you get used to the masks, they are completely comfortable. They don't carry any risks. People say, I start breathing heavily, I struggle to breathe, but that's not true. Masks are completely risk-free. I should say that they protect us and they have no side effects. That's one thing that we have made as health workers and is completely out of side effects.
Okay. Doctor, what do you have about people who sleep in masks?
Now, it is not advised to sleep in a mask because sleeping, by the time you sleep, we believe that you are alone and you have isolated yourself.
Is there any danger associated with that?
There is no recorded danger per se, unless if you are putting on a mask maybe in a wrong way, in a wrong way. Now, and one thing that you should say about masks, some people put on masks, but they put them on their chin. They don't put them on the nose. Every mask should cover your nose and mouth. If you put on a mask and you just put it on your chin, it is useless. You rather don't put it on. So make sure that your mask is is covering your mouth and your nose. Now, something else about a mask. One was asking about how when they are removing the mask, don't they get affected? Now, the proposed and the right way of removing a mask is using the ties. You should not touch in the front of the mask. You should use a tie. Those things that go all around your ears, they are the ones that you're supposed to hold, and then you put off your mask. You are not allowed to touch in front of the mask. That is a mistake that many people do. But when you are removing your mask, make sure you touch the threads or the things that go around your ears and remove your mask. That way, you will not carry any risk of getting infection on the virus that was on the mask. The last person was asking that people get sick and after 3 days get better. Now, I would like to appeal to Ugandans that other diseases have not run away because we have corona. We still have malaria. Malaria is still killing people and is still around. We have typhoid. We have all sorts of diseases. Now, someone getting sick does not necessarily that they have corona. Someone getting fevers does not necessarily mean that they have corona. That's why we keep emphasizing seek medical care. So that a health worker who is trained will be able to say this is coronavirus, or this is a common malaria, or this is a heart disease, hypertension. All those things still exist. So do not say it is only corona and you say, we will do what we've had and we use our remedies. But make sure you seek medical advice and we will tell you whether it is corona or not.
Very good. One last question. I was in the village a couple of days ago. I found an old woman that is hesitant to come to the clinic. She was sick, but she says, oh, corona in the clinic, corona in the hospitals, I'm not going there. And it was really hard for me to convince her that she still needs to come to the hospital. What sort of advice do you have for such people?
Now, one thing that you should know is that as a hospital, we have measures that we've put in place that, first of all, the health workers don't get infected. And then people who come and have other illnesses do not get infected in the process. Now, if you are sick, do not be hesitant because that sickness will kill you before corona kills you. So you would rather get to the hospital and seek medical advice. I can assure you that there are very, very minimal chances that you will get corona from the hospital. You are likely to get it in the community, likely to get it in the taxi, on the border, than you will get it in the hospital.
Thank you so much, Doctor. I can see we are time bad. Our viewers, we thank you so much. Our listeners, we thank you. It has been a pleasure having you, Dr. Ambrose. We've learned a lot. Thank you so much, Grace Radio, for this welcome host. And once again, this has been a day and a session that has been brought to you by staff from Mbarara University of Science and Technology with an open learning project, and we have specifically been talking about COVID and how we can best prevent it. Thank you so much. God bless you.